Hi, my name is Lydia.
And I'm Nena Schvaneveldt, and we're at the Eccles Health Sciences Library.
And we I want to talk to you today about how the Health Sciences Library has worked on our assessment practices for teaching. The assessment is kind of a pain point for a lot of instructors, and the library is no different. We largely relied on student feedback for a long time, leaving any additional assessment up to the individual instructor. So in 2022, when the Center for Teaching Excellence put out their framework for teaching, Nena saw an opportunity for us to readdress how we were doing assessment. So we incorporated largely what was found in this framework and put in a three-pillar approach that uses not only student feedback, but also instructor reflection and peer review. As I mentioned, we had a student feedback form, but we wanted to include more formal instructor reflection and peer review in our practices. So as a team, over several meetings, we updated the student feedback form and created forms for reflection and peer review for requesting, volunteering, and then actually doing peer review. And we put links to these forms in our Microsoft Teams channel, so everyone on the instruction team has easy access to these forms. So after finishing teaching a session, the instructor can look at the student feedback and use that to inform their reflection. And we're still starting the peer review process. We've only had a couple peer reviews, but not so far.
Yeah, so on the reflection form, there are links to some of the other ones to kind of help get it all in one place, because after we teach, our brains are fried. So the post-teaching form contains reflection prompts, and when that form is filled out, it alerts the person responsible for data analysis, and that person is an administrative assistant. So it's not one of us talking about how great we're doing. And they identify the areas of excellence, development, and ways in which we also align with the university's outstanding teaching definition. And so we began using the reflection form in fall 2023, and then peer review has started like this semester in earnest. So we've only had 2 so far. Well, 3 now, but 2 when I did this. And then we've had reflections from 31 sessions, and we have demonstrated evidence in all 5 of the pillars of teaching excellence. The smaller bar is assessment, because it's really hard to tell if the students know how to use PubMed in a meaningful way. But our learner feedback is overwhelmingly positive, and we're able to kind of identify some of our areas of growth, of barriers. So things like technology, learner engagement, and instructor preparation. So things like, I wish I had made this more active so that the students wouldn't have been falling asleep, maybe. And yeah, that's where we're at. So it's worked for us, but we still need to figure out if they're learning what we're teaching them. So that's where we are. Thank you.